Hello everyone, and welcome to the Pain Channel. My name is Rosalie Michaels, and in a moment, we will go to Dr. Steven Sywick, Director of the Pain Center of Arizona. Today, we are going to be discussing a procedure called radio frequency. Now, you may have seen this technology prevent or catch shoplifters. Now, who would have thought that this could be used in a procedure to provide comfort to millions of people who deal with multiple locations of pain? So what are the typical patients that you see, Dr. Sywick?
Typical patients for this type of procedure are going to be really across all ages. To be honest with you, it's probably more common in the senior population, and that's because as we age, the discs in our spine, which are made up of water and collagen, will oftentimes start to dry out and degenerate. When those discs, or the shock absorbers of the spine, become worn down, it places a lot of extra pressure and a lot of extra load bearing on those small joints, again, these facet joints. Over time, with a lot of friction, those facet joints produce the inflammation that we otherwise describe as arthritis.
Well, what can typical radiofrequency candidates expect for procedure, and what available treatments are there for facet joint pain?
Facet joint pain, again, is one of those things that we approach simply like an arthritis discomfort right off the bat. The difference is the end of the story. If you've got severe degenerative arthritis of the hip, we've got the technology today to give you a hip replacement. Or similarly, if you've got horrible degenerative arthritis of one or both of your knees, at some point an orthopedic surgeon is going to talk to you about knee replacement. We don't have the technology yet for spine replacement. So right now, typically what will happen is you'll meet with one of the physicians at the Pain Center of Arizona, and we'll talk about the conservative therapies first. Those conservative therapies are some of the simple anti-inflammatory medications, or even a muscle relaxant or a low-dose pain reliever. Oftentimes that will then segue into some physical therapy modalities, ultrasound, deep heat, massage, things to get your spine up and moving, things to strengthen that core, to take a lot of the pressure and the degenerative change and that discomfort away. When the simple therapies don't fail, there is this exciting procedure we have at the Pain Center of Arizona called radiofrequency ablation. Simply put, there are small little nerves that give some of that pain sensation to these arthritic facet joints.
What is radiofrequency ablation?
Radiofrequency ablation is a way to target those small nerves, and we burn them with a small needle probe. Once we do that, the pain that's been generated from those arthritic joints simply goes away. Before you're a candidate to get to the radiofrequency, of course, there are a couple of test procedures that we'll do. These are done all as an outpatient at one of the locations of the Pain Center of Arizona. We'll have the patient on the table. We do all of these procedures under live x-ray, which allows us to see exactly a second-to-second placement of where the needle and the probe will end up being. The initial procedures are small little injections right inside those tiny little joints, where we put some pain medication and an anti-inflammatory to see if the patient does well. There are several patients that will simply respond to just some small pain medicine and an anti-inflammatory right into those joints. If it's the instance where the patient comes back and says, well, Dr. Sywick, good news and bad news. The good news is that injection you did to put some anti-inflammatory medicine in and around the joint, it was amazing. But the bad news is the pain shortly came back. Those are patients typically that are excellent candidates for this exciting procedure called radiofrequency ablation.
How long can the patient expect to see relief?
The recovery time is pretty quick, actually. Most of the patients are still fairly numb from some of the local when they leave, so it's not a painful procedure at all. And again, it's usually done under some light sedation, so the patient is comfortable through the whole procedure. Once they get to the recovery room, sometimes there's a little bit of minimal discomfort. I tell most of my patients that you can expect to have a little bit of minimal to mild discomfort for the next several days. There, on rare occasion, there have been some patients that have been a little sore for up to a week. But again, this is a very safe procedure. It's a very simple procedure because of the fact that I've got live x-ray when I do the whole thing. Usually after about several days to a week, the patient really begins to notice that benefit. Typically, again, those motions that were causing some of that significant pain, again, let's say it's the back, those pain with bending, twisting, turning that was across the back into the hips, into the top of the legs, is simply gone, or in at least most cases, significantly improved. The goal on this, of course, is to get those patients functioning again. It's about a better quality of life. It's about a better level of functioning. In most cases, if the patient was on any significant pain medications, we can drastically reduce the amount of pain medication. As to the issue of how long this lasts, the studies are pretty clear. This is typically a procedure that will have destroyed those nerves for about 9 months to 18 months. We don't know why, but those nerves will grow back, and sometimes even though they grow back, we don't know why, but there's patients that need the procedure one time and don't need it again. I have patients that'll come back pretty much on a regular basis every 9 to 18 months for a tune-up, we call it, and then again are doing really, really well. This again it's a wonderful, safe procedure. It's been out there for many years. The refinements over the years have been about just smaller needle probes and proper heats and etc. But this is a wonderful, safe therapy that's changing lives.
Okay, please explain those procedures to us, Dr. Siwik.
All right, so now we're seeing an actual procedure done at the Pain Center of Arizona by Dr. Douse, one of the pain consultants at the Pain Center of Arizona. Today's procedure, of course, is a radiofrequency ablation procedure. And remembering that the facet joints can affect the neck, the mid-back, the low back. Those are joints that go from the top of the spine all the way down to the tailbone area. So today we're watching Dr. Doust in this procedure suite to prepare the patients. Dr. Doust is using x-ray guidance throughout this entire procedure, and what you can see is that allows him to really detail specifically these joints in the spine. What Dr. Doust is doing now is he's numbing up the skin in preparation for placing the active needles. What you see Dr. Doust doing now is taking the needles and, again, under live x-ray guidance, he's placing those needles right down to the level of where those specific nerves are that cause a significant amount of this arthritis pain. Now that Dr. Doust feels comfortable that the needles are in the appropriate place, as evidenced by the x-ray, he's using these cables that are hooked up to the radiofrequency generator machine, and he places these small stylets right into the center of those specialized needles. Now Dr. Doust is asking the assistant to turn on the machine and to start to generate some of that heat. At this point, Dr. Doust has the needle probe inside those specialized needles, and the heating has begun. Notice that the patient is completely comfortable throughout this procedure and is really having no discomfort at all, despite the amount of the heat that's being generated through those specialized needles. And again, that's because there's a lot of numbing medicine that was placed in there. So again, this is a very simple and comfortable procedure. Now that Dr. Doust has done a radiofrequency ablation treatment on each of those levels, he will now carefully remove the stylets and return those cables to his assistant. This patient has had an excellent, successful procedure, so now this patient will be taken to the recovery room, and we'll monitor them closely for the next 30 minutes to an hour. And as I said earlier, the patient might be a little bit sore for the next several days or so, sometimes up to a week. But the end goal here, it's about a return to a quality of life. It's about a better level of functioning. It's about getting our patients back to life.
Well, Dr. Siwik, thank you for being with us today and informing us about this wonderful procedure, radiofrequency ablation.
Thanks again, Rosalie, and we'll see you next week.
After the procedure, we went to Dr. Doust and asked how the procedure went and what the patient can expect in the future. Here's what he had to say.
Procedure went great, so she didn't have any problems whatsoever. Hopefully she'll get as good a response in her cervical spine as she did in her lumbar spine. In terms of what to expect in the future, this isn't a permanent technique, so sometimes it does come back. On average, like I said, it lasts about 6 to 12 months, some people more, some people less. So she might expect in the future that we may have to repeat this somewhere down the line, but hopefully she'll get a long, pronounced pain relief, and we won't need to see her again. A lot of our patients too are able to get off of their medications and narcotics after doing this, which is always a benefit.
Experience the Pain Center of Arizona and get back into life. Call 1-888-PAIN-CENTER.
The mind-body connection for pain has been under study for what seems like forever, which should come as no surprise. After all, if you could just mentally control your pain, wouldn't that be a less risky approach than popping pills with their own litany of possible side effects or undergoing various invasive procedures? Now, once dismissed by many as another one of those new age things, the highest levels of the scientific community are rapidly accepting mind control as one possible solution to address a very complicated physiological problem, pain, which plagues so much of our population. In fact, some studies have shown that more than half of all Americans suffer from chronic pain. Now, pain may not seem important unless you're one of those suffering from it. Doctors believe that there are two pathways for pain: the sensory or physical pathway and the emotional pathway. How closely are the two pathways linked? Well, according to the Harvard Medical School, patients with chronic pain are 3 times as likely to develop psychiatric symptoms as other patients, and depressed patients are 3 times as likely to develop chronic pain symptoms as their non-depressed counterparts. A famous 2005 study at Stanford University looked at patients' ability to control pain levels with their minds. Patients could actually watch their own brain activity in real time using functional magnetic resonance imaging, or fMRI, and were given various kinds of mental exercises to try in controlling those images associated with pain levels. Research results showed that patients were indeed capable of controlling pain. A positive side effect was that by doing so, they felt more empowered in the ownership of their pain situations. Sean Mackey, one of the project leaders, said that the medical community was moving from a perspective that would separate the mind and body to one that would integrate the two entities. It's that time in the show where we go to our team on the streets who've been talking to everyday people about their experiences with pain. Let's check it out.
Do you experience chronic back pain?
Yes, I do, and I have for about 20 years. At that point in time, they took a tumor out of my upper spine, and that affected the nerves in my right shoulder, which really took away the use of the right shoulder. The pain emanates from the shoulder into my back. I have found over the years that what really sets me back is if I become inactive, if I'm not always moving or working out on a treadmill or a recumbent bike. The endorphins that I get from that go away, which acts as an opiate, and then I have the back pain.
Are you currently on medications for your back pain?
The only thing is I'll beg somebody to give me a Percocet or something if I have a 4-hour drive or I have a plane to take. But again, the endorphins act as my medication.
Show business is a tough business with performers often doing whatever it takes to get or stay ahead. Entertainer Jerry Lewis has been known since the 1940s for taking pratfalls to garner laughs. Now, one such fall during a 1965 Las Vegas show earned him both laughs and a major back injury. Early treatment involved administration of the powerful painkiller Percodan, and Lewis became addicted to it. He later kicked that habit and was given an electrical implantable device for pain relief, which he continues to use this day. Well, that's our show for today. Thank you so much for joining us here at the Pain Channel. Please join us again next week on Wednesday at 3 p.m. for a brand new show featuring Dr. Cywick and his team. We'll see you then.